Hey everyone, my name is Kelsi Jamison, and I'm a Pharm.D candidate for 2023 at the University of Mississippi School of Pharmacy. Today I'm going to be speaking with you about the social determinants of health screening use evaluation in health centers in rural Mississippi. My co-investigators are Dr. Megan Brown and Dr. Megan Rosenthal. For a little background, there are over 200 rural health clinics in Mississippi, and there are approximately 3 million people that live in Mississippi. Unfortunately, a lot of these rural health clinics and rural health facilities are closing rapidly across the country due to lack of resources and funding. In Mississippi, many patients actually experience poor outcomes due to financial, social, and geographical disparities, and these community health center patients often experience social determinants of health barriers, especially those located in rural areas. So if you look to the right, you'll see a graphic of Mississippi and its county lines. And for the light blue color, those are the counties that are considered metro counties. The dark blue is considered non-metro counties. Most of this map is dark blue, and therefore many of these patients are living in these rural areas. So there are screening tools that are used to assess social risks and health disparities that may affect patient outcomes. There's one, for example, is the Prepare tool, which is very useful for these purposes. The usage of these tools allows providers to create targeted plans that can address social determinants of health and even improve patient outcomes. So the purpose of this research is to assess whether community health centers in Mississippi are utilizing social determinants of health screening tools and to determine whether its usage within these health systems correlates with better patient outcomes. As for our design methods, once IRB approval is obtained, we will work with the Community Health Center Association of Mississippi to identify individuals within the community health centers, or the quality improvement officers, who are responsible for implementing quality initiatives. Once they are identified, these individuals will have the option to participate in recorded focus groups or individual interviews to discuss the successes and barriers of tool implementation, use, and utilization of the results. Once this information is captured, we will analyze the data to identify themes that exist across these different community health centers across the state. As for our expected results, we expect that the majority of the health centers that we interview are using these social determinants of health screening tools effectively, but they're not necessarily able to utilize the information due to barriers that we hope to identify. We also expect, due to our own experience working in community health centers, that the information sometimes helps to identify barriers, but resources are not easily available to clinic staff for them to make proper recommendations and close the loop on all problems identified by social determinants of health screening tools. So in conclusion, we hope to identify successes and barriers that can be shared with others in these rural areas, and we hope that we get to have a part 2 to this research in which we could create workflows, processes, and resources that these community health centers can utilize and hopefully get this published, because there is a lack of data available in literature currently. And hopefully this will allow community health centers to use this information and create better outcomes for their patients.